Welcome everyone to Health Coach TV. I'm your host, Dr. Shauna Menard, and wow, we're gonna have a fun one. Anytime we got Cookie in the house, we are having a fun time. And so we're gonna be talking about lymphatic system. And if you want to combine lymphatics and fun, well, Cookie is exactly the person to educate you and have you feel great about it. And some of you might go, lymphatics, why do I care? You're going to care. You're going to want to know. So thanks, Cookie, for being here.
You're welcome. I'm glad to be here with you guys. I have lots of information that I want to share with you.
Awesome. You sure do. Like, you are a wealth of information. So let me properly introduce you. So Cookie Caldwell is the lymphatic health coach. She was born the oldest of 7 kids in St. Louis, Missouri. She was an infant when she first encountered the functioning of the lymphatic system. She was just 9 months old when she jumped out of her cousin's arms, landed behind the couch on a hot radiator, burned her pre-auricular lymph nodes, not knowing that 50 years later she would become the lymphatic health coach of the world. She attended Santa Ana College and Cal State Fullerton University in California. She moved to Missouri in 2002 and graduated from Norton School of Lymphedema in 2012. She's been at this for a while. As a certified lymphedema decongestion therapist, she's also a certified medical therapist and a national board certified massage therapist. She has been infatuated with the lymphatic system and teaching people how to keep their lymphatic system flowing at peak performance for over a decade. She developed her own special technique over the years, and from some very special clients, she has developed her own technique, Lymphosage, that is in such high demand, both from her clients, but now also other therapists who are eager to learn her technique. It delivers fast, visible results. It's what has her with such a full practice. People are really wanting that other therapists are like, what are you doing? How are you getting these phenomenal results? It's like a facelift for some people if they're doing it like that. So they're just like on it. And so Cookie lives in beautiful St. Peters, Missouri with her husband, Julius Caldwell Jr., and their fur babies, Goldie Golden, the Chihuahua, and the hardhead Arabella, the Havanese. Can you see? We're going to have a fun time with Cookie. So with that, welcome, Cookie.
Hello, I'm glad to be here.
Awesome. Okay, well, tell us, what is it that you do? Tell us, how would you describe what you do?
Well, I will describe it as me being the lymphatic health coach of the world. So I help people overcome stubborn illness, aches and pains, edema, post-surgery swelling, and fibrosis by eliminating lymphatic congestion and toxicity from the body for faster recovery and optimum results.
Awesome. Yeah. And you certainly do that. And it's far reaching. And we're going to dive in, for any of you listening, we're going to dive into what is the lymphatic system? How does it work? All that's to come. She's got some phenomenal tips. We might even share a video or 2 of hers. So we've got really some good stuff coming up. So, all right, how lymphatic system? A lot of people don't even know they have a lymphatic system. How was it? And you're infatuated with it. So how is it that you got into this line of work? Tell us your story of how did this happen?
Well, as long as I remember, I always wanted to help people get out of pain and feel good about themselves. I remember my clients, well, let me start with me first. I was on a cruise 20 years ago with my husband. We was on a honeymoon, and we had been cruising for we've been on the cruise 3 years in a row. And all 3 years, I gained at least 10 pounds. So I was 30 pounds overweight. I was tired, puffiness. I knew I couldn't stay that way that long. I was miserable. I came up with a game plan, and it worked. So 17 years later, I worked at a medical massage therapy place in an upscale. I worked as a medical massage therapist in an upscale spa in Frontenac, Missouri, where I met a 59-year-old woman. She told me she was tense, she was bloated, she had low back pain. So we did an evaluation and an assessment. And immediately we started working together on a treatment plan to remove inflammation from her body. and reduce the low back pain and help her get rid of the bloating. 5 years later, my client announced to me that she had breast cancer surgery with lymph nodes removed from her breast and armpit, which was causing swelling in her right arm. She called me one day and said she was moving back to St. Louis, Missouri, and that she would pay me to return to school to get my lymphedema certification. I said yes, but I didn't even know much about the lymphatic system. Year after year, I became more intrigued with the lymphatic system and its speedy recovery that it had on the back, on the body. So I want to know, she asked me, so I want to know if I pay you to go back to school to get your lymphedema certification, would you? I said yes, even though I didn't know much about the lymphatic system at that time.
Yeah.
Year after year, working on my clients, I became more intrigued with the lymphatic system and its speedy recovery it had on the body.
Awesome. That's so great, Cookie. So I remember you telling me about this woman, very special woman, and really quite a pivotal moment, one of those turning point moments really in your career, I guess.
Yes.
You know, being a massage therapist and working at that medical clinic, then this opportunity arises, and to be offered to, she obviously saw something in you, and your raw talent and your interest in it, and then to be able to take it to the next level. And that's been like kind of like the eternal quest here, is you're continually refining and specializing and continually looking at how can I help them get better results? How can I help them get better results? And when you look back and when you look at the results, no wonder people are lined up to come and see you, because you know, excellence, you know, it speaks volumes. So tell us a little bit more about how'd you do that? Tell us maybe a little bit about, okay, so you get that certification, and maybe fill in the blanks a little bit. Tell us about a couple of these people that have come your way, and what happened, and how you gradually were, you know, chiseled out, became from a massage therapist to the lymphatic health coach. So fill in the blanks a little bit for us.
Well, you know, doctor, I remember using manual lymphatic drainage on myself all my life, and I didn't know it. I was such a happy baby, but I was so happy that I would play with my cousins and they were happy to play with me. And one day I just jumped out of their hands. And what I did was I fell behind the couch on a radiator, and I burned my pre-auricular lymph nodes right here on the side and didn't realize it. But I had seen, after seeing positive effects of manual lymphatic drainage on my clients, over a decade ago, a 47-year-old divorced mom walked into my wellness practice looking emotionally exhausted. She said she was in desperate need of manual lymphatic drainage. Now, this was one of the few women who knew what she needed. She explained to me she had breast implants, she had a lot of surgery going on, liposuction, a tummy tuck 2 months earlier. She thought the compression garments were enough, but her plastic surgeon had recommended that she get manual lymphatic drainage massage as soon as possible. But of course, she did not listen to his advice. So there she was in front of me in excruciating pain. She told me her swelling had gotten worse. Her abdomen had hard, fat pockets under the skin, which is fibrosis. And she was suffering from chronic fatigue and depression. She was constipated and full of toxins. She told me she could not even think straight. But the worst part, Doc, is she said she could not sleep without being interrupted by pain for more than 3 hours. Can you imagine sleeping and all of a sudden this pain is waking you up? That's so unbearable. She begged me to help her get rid of the painful swelling and fibrosis. So we proceeded to work together as I walked her step by step through a sequence to improve her lymphatic flow dramatically. Within a matter of weeks, she was a different person. She came in to me and she exclaimed, "Oh my God, Cookie, Thank you. I love you. And I am in love with the new me. I really enjoy feeling well rested when I wake up. I love that the aches and painful swelling are a thing of the past. I have mental clarity and I feel comfortable in my new and improved body with lots more energy. God is good. I was thrilled. And it was such a powerful example of how improving your lymphatic system can make a huge difference in your overall health. Since that time, I made it my mission to help people eliminate lymphatic congestion and toxic buildup so they can decrease the discomfort and the inflammation, the aches and pains. And we do this because we want to get fast results and fulfill my original mission to help people be happy with their bodies, turn down the pain, and feel good about themselves in a more refined way.
Yeah, that's awesome, Cookie. You know, as a radiologist as a medical doctor and then as a subspecialty radiologist, I worked in ultrasound a lot. And so I saw a lot of these women with their fibrosis and the pain and scarring and how painful that really was for them, excruciating. And they often didn't really have a great option. A lot of the women that I would see as patients, their plastic surgeons had said, or their surgeons, depending what the procedure was, had said to do it themselves. Yeah. You know, they were being told to do some of this stuff themselves, and they didn't really know how to do it. And so they were kind of left underserved. They didn't have someone like yourself. You have a video. Let's see if I can find it here. Okay. Really quick. It's only like 90 seconds or so. And that might be helpful to just play to kind of, you know, what I like in this video that you have is it explains about the lymphatic system a little bit about, or how especially towards the end of it, it's only 90 seconds, but it's worth it, especially for the end where it shows what the lymphatic system does and what manual lymphatic drainage does and how that can actually help you. It's really fantastic for weight loss and getting rid of cellulite and all sorts of things. And we'll talk more about that, and we'll give people some tips if they're listening in, but all the way to some like serious things like malignancies and different things like that. So let me see if I can share my screen here, and we'll just take a quick peek at this. Let's see.
First, the problem client comes into the clinic and preps for surgery. Next, the certified plastic surgeon comes in and administers anesthesia. Then he performs a liposuction by suctioning out the fat with a wand called a cannula. He moves it back and forth through the tissues, sucking the fatty tissue out of the body. Or he performs a tummy tuck, or both. A tummy tuck procedure requires a horizontal incision from hip to hip in the area between the pubic hairline and the belly button. Next, her nurse will perform some manual lymphatic drainage before sending her home with compression garments. And sometimes they go home with drainage tubes, which continues to drain out excess fluid. It is important for the client to implement her plastic surgeon's recommendations of getting manual lymphatic drainage and lifestyle changes to avoid post-op complications like fibrotic scarring, hardening of the tissues, lumpy fat pockets under the skin, trauma to the muscle cells, excessive amounts of swelling, fatigue, constipation, toxic and congestion, headaches, brain fog, and interrupted sleep. The most beneficial part of getting manual lymphatic drainage is it moves and strengthens your lymphatic system to crave a healthier lifestyle change, like drinking more water, moving and rebounding, eating more fruits, vegetables, and less processed foods to help avoid sickness and inflammation.
That's awesome. Let me just stop the share, bring it back to us. I think that's helpful just to kind of get an idea for people who aren't familiar with it and kind of the broad range of things, and that there's things that they can do to improve their lymphatic system. And once you started seeing these tremendous results, like these women who've been in so much pain and then they're feeling better in your own life, how the improvements you got, able to lose that, 36 pounds and youthful, it's up to you whether you want to share your age or not.
Sure. Yep. July 11, which is coming up, 7/11. I'll be the big 6'2". I mean 26. I mean 62. But yeah, yeah. I think it's 62.
Yeah, knocking on the door of 62.
Yeah.
And look at her. I mean, I'm just saying what she does works.
Yeah.
And so, and you look beautiful, you look youthful, but your energy is like off the charts. I know we're doing this interview thing, so you're more stilted, let's say, than you normally are, but you are like vivacious, and well, people can get that. People can get that like eager, childlike, enthusiasm for life and for all of this great stuff. And so it's just so phenomenal. And I think what you have to share is really important. And I don't think a lot of people appreciate that. And hopefully what we're talking about will sort of have at least people wonder, well, how is it that she looks so fantastic? What is it that she's doing? And why are all of these people lined up to see her? Was this the other day you were talking, you had like 50 new clients, 50, like, wahoo, right? Like that's a lot. So, I mean, if what she didn't work, people would not be, banging on the doors here. So you definitely get results. And you show people how to do it themselves. We'll get into that a little bit. So like if you're not in Missouri, say, it's still okay. She can walk you through this and some of these really great techniques. So because it's important and you want to expand your reach. So seeing these people get great results, is that why you decided to become a health coach?
Yes. The first thing is a lot of people couldn't find a lymphatic therapist to help them after they went. There's so many cosmetic surgery that was going on, and these people had so many issues going on, so much pain, but they couldn't find anyone to help them. So we came up with this step-by-step program that actually get results. So I liked helping people make healthy lifestyle changes by improving the lymphatic flow to overcome stubborn illness, aches and pain, discomfort, avoid post-op complication before and after surgery. It's not just for people who've had surgery, it's for people who have discomfort, bloating, issues that they can't get rid of, they can't resolve. And a lot of it has to do with the lymphatic system.
Yeah, perfect. And I think you kind of really answered it. And you really take people who are frustrated or in pain or discomfort and fearful and congested. And if they don't have a more significant disease yet, they're on the track to that. And you take them from there and then just help them be more energetic, youthful, lean. Even for the people who are healthy, cellulite in itself is something that, most women I know are like, how do I get rid of this? And we're coming to that. But what would you say is so people see massage and they see that video and they see massage. What's the difference between what you do and say a deep tissue massage or a Swedish massage? What's the difference between that and this lymphatic manual drainage and what you talk about?
Well, the lymphatic, Swedish massage and deep tissue massage are actually for the muscles, and they actually help relax the muscles, and then they help also release some of the tension in the muscles. Right. So that's the difference right there. And so many people think that manual lymphatic drainage, Swedish and deep tissue massages are the same, but they're not. The manual, like I said, deep tissue massage, Swedish is for relaxing and for tension in the muscles. Manual lymphatic drainage massage goes places where the lymphatic and the deep tissue can't go, and that's into the swollen areas of the body. So when you get through getting all that drainage, moving stuff around, toxin out of your body, kind of decongestion, everything, that kind of temporarily leaves you exhausted because we've moved stuff that's been in there, and now the system is doing its job. So when you get to that, and after you get the drainage, you may want to eat a light meal or lie down or relax for the rest of the day and give your body time to ease back into the activities.
Yeah, awesome. I popped up a picture of your logo, which includes kind of a visual of the lymphatics.
Yes.
And like, maybe just kind of like tell people a little bit about, before we get into some tips and how they can improve the flow, like what's the lymphatic system anyways? Like what does it do? Or if you want to share tips, whatever order you want to go in, but I want to get to both of those. But I thought this visual, as you were talking about that, they could kind of see, okay, that one's for muscles, this is for the lymphatic flow. So yeah, share away. What is this lymphatic system?
The lymphatic system is actually our body's defense mechanism. It fights against, it's a network of delicate tubes of lymph vessels. As you can see throughout the map, you see those lines. Well, that's lymph vessels that's going throughout the body, and then it has lymph nodes. The lymph nodes you see, like you see under the arms. Most of our lymph nodes is in our face, in our neck. You see nodes in your chest. We have inguinal lymph nodes between our legs, and then we have lymph nodes behind our knees. These lymph nodes are there to the lymph vessels. Actually, it travels through the lymph vessels to the lymph nodes, and it drains. What it does is the lymph node tissues. Okay, wait, first I said there's a defense mechanism against sickness, illness, disease that tries to get into your body. And then it's a delicate network of tubes of lymph vessels, which you see, lymph nodes, tissues, and cells throughout the body. So what it does is it drains fluid called lymph that has leaked from the blood vessels into the tissue, and it empties it back into the bloodstream via the lymph nodes. The main role of the lymphatic system is that it manages the fluid levels in our body. So the lymphatic system is twice as big as the circulatory system. There is 2 times more lymph vessels than there are blood vessels, and the vessels are much thicker. So that's why it's able to eliminate toxin and viruses and bacteria from our body. These swollen lymph nodes are usually caused by an infection in your body. So there your lymph nodes go. If you feel swollen lymph node, you know how you go to the doctor and he always feel right there, or she's trying to feel to see if it's swelling there, and if you have an infection in your body. That's the first way they discovered that something is going on, because they touch your lymph nodes. Now the swelling is caused by increased lymphatic fluid in the lymphatic system. Yeah. And some of the benefits of manual lymphatic drainage that you have seen with your clients are, you may have seen and I have seen post-surgery clients come into my office scared, depressed, wondering if they made a right decision about going to get the post-surgery, because they have all this fluid that they've never seen before. They're swollen, and it's like, what is going on? The doctors don't really tell them much about it, and they don't understand why they have all this painful edema going on.
Yeah, this is really helpful. And I think, when I, again, as a radiologist, we would see, you can look at the architecture, the ecotexture, if you like, of the lymph nodes, and see whether looks like it's from infection or malignancy, or even some foreign things. So for example, silicone. So people had implants, and then we would see silicone in the nodes, and we could actually see that. So the lymph is trying to filter out some of that stuff. It's trying to clear some of that stuff out and trying to protect us as best it can. But if it gets congested, it doesn't work very well. If you got your drainage tubes in your sink, it's trying to clean things out, and it gets clogged, it doesn't clean very well. You can't filter things out very well if it gets clogged up. So getting that flow is tremendous. So that's really great. I'm going to stop this share of that. And then now just tell people who are listening here, just some tips of how can they improve their overall lymphatic health. What were some simple things that they could do like today if they're like, hey, I get it, it's important, it leads to significant disease, it has certainly a role in weight loss as well, which a lot of people don't appreciate. What tips would you give them for that lymphatic health that helps them look so youthful and glowing like you're doing?
Okay, so you saying the tips that they need to
improve their lymphatic health. Yeah.
Okay. Some of the tips that I will give them are like they should drink more water.
Yeah.
It's very important to drink water that's clean, that's purified, because the lymphatic system is made up of clear liquid that can sometimes get congested. And what keeps it flowing is actually water. Water is the key to getting everything to moving and to flowing. Breathing, that's another thing to get your lymphatic system to going. You should actually, a lot of people breathe the wrong way, but when you're getting ready to before you get your activate your lymphatic system, I always tell people to let's go ahead, put your hand right. You see where your collarbone is, right there. Okay, and then on each side, because I do this all the time, I'm always with one. But when I first start telling people about it, you put your collarbone, just lay it right there. Take a swallowing up, just swallow a little bit. Take a deep breath in through your nose because you're pulling all of that oxygen in, and then you want to blow out through your mouth, blowing out that carbon dioxide. So you're getting prepared for your lymphatic system to work for you. So you're going to slowly, let's say you're taking a nod, and then as you nod, your hands are going to move down just a tad bit. You're actually activating your lymphatic system. Take a nod, and then lift back up. And you do that like 4 or 5 times, you're going to eventually feel the swallowing. And as you do that, you want to go up just a little bit more. And you just, and if you're doing it right, after you practice for a little while, you're going to feel things moving. You're going to actually feel, you can feel it all up in your head. You're going to feel stuff moving. And then I tell people one more thing to do is you're going to put your hand back here where your occipital bone is. You put your hand back there, and then you're going to go straight down as if you're trying to take the nose that's on your occipital bone and you're trying to bring it up towards your clavicle, which is your collarbone. And you're going to do that a couple of times, 5 or 6 times. And then you're going to bring it back down to the middle, because you want to pull all of that down. And then you want to bring it back. And another way to just crisscross your hands. If it's harder that way, crisscross your hands. And then you take it right back there. And then once you practice for so long, you're eventually going to catch on, and you're going to feel it. It's really gentle because your nodes are right under your skin, right under it. If you feel muscles or anything else, you're too deep. It's very, very light. It's like when I did the nod and you move your hand just that little bit, that's all it takes to start activating your lymphatic system. Now, to activate those deep lymphatic systems, you got to move. You have to move. You can't. If you're not moving, your lymphatic system is not working. And your lymphatic system, you do not want that to go into lymphatic overload. That means it's congested. You haven't been drinking enough water. It has thickened on you, and it's just stuck. Nothing wants to move around. So you have to move to get it to going. And those deep nodes, you know, a lot of things, only thing you have to do is run in place, do some jumping jacks, jump up and down, jump rope, you're activating your lymphatic system. See, all of that is activating your lymphatic system. And that's how you activate your lymphatic system. There is dry brushing also. That's another one that you want to do. But the one thing I want to make sure I go back to and make everybody understands this, it's very important to breathe in through your nose, because you can't get oxygen in through your mouth. It goes through your nose, and then you have to blow it out through your mouth to blow out the carbon dioxide. That's a number one thing with me. Everybody that I touch, they have to know it, that routine before we get started. And then you're a lot more relaxed then. Then you can go to working on your nose, but that breathing is so important. That drinking water is so important. You'll see such a big difference in your life just with those two things. And then there's another thing that you can do, dry brushing. Dry brushing. But before you dry brushing, a lot of times they don't tell you this little secret to get things to actually really moving on you quicker is what I just showed you, to activate the terminix. You're putting everything in through there. So you want to activate that first to get it going. And once you get that going, you can just go, you start your dry brushing, you can start at your feet and then you work your way up. But you just want to lightly brush your body, brush your feet, brush the bottom of your feet, brush your legs, just come on up, just, you know, oh, I deserve this body. Do you like this? And talk to it as you're doing it all the way up. You want to brush your back, brush your stomach. And once you get through your body is going to feel so good because it's tingling. Now it's those nodes are working under there, those vessels are working. Then you can take your shower, but it's so important to do it on dry skin because you want to exfoliate at the same time. And another thing that you could be doing is getting rid of some of that cellulite. That's another secret that goes on with the dry brushing. Those are my tips for you.
Those are awesome, Cookie. And you know, I'm glad you said that. I bought a brush for dry brushing years ago. Because they said you can use this for your cellulite. So I'm like, all right, let's do it. And so I had zero instruction. So I had a brush. And in my mind, I'm like, well, there's those thighs. I'm going to just scrub them like I was trying to like scrub a pot. My idea was, I don't know what to do. So I was just scrubbing back and forth, kind of hoping that it would just scrub away like dirt.
And the other thing is, another thing that I forgot to mention about the lymphatic system. With the lymphatic system, the lymphatic drains up from your feet up to your, where you want it to drain into that service, that
subclavian.
Yeah, the subclavian you want to drain up, and then the face is the only thing that drains down. So everything drains down into the cervical, into this collarbone. Everything drains in there, and then everything drains up from your feet. So when you're doing the lymphatic drainage, the dry brushing, keep that in mind. That you drain, as long as you're sweeping, as long as you brush, and you don't want to do it too hard because it can irritate your skin and you won't do it anymore. You want to do it as light as possible the first time. You may not think anything is going on, but your skin can feel that stimulation. So always remember, you brush up and your lymphatic, everything goes up. And then when you're doing your face, you can do dry brushing on your face, very, very light dry brushing. You can even, I use dry brushing with a towel as well on your face, but it all goes down and then everything goes up. That was very important for me to let you know that.
Yeah, I wish, because I tried it a little bit. I'm like, this isn't working. I don't see this. And I just kind of was like, other than making my skin red, I didn't really
see you were doing it too hard, too rough.
Instead of so do you have any tips for the face?
Okay, now the face, I would tell everybody, remember, I always say you start right here.
Yeah.
You start right there at the collarbone, and then you're going to work up your neck. You're going to go slowly up your neck, and then you're going to go to your submandible nodes or down here. And this is all getting ready to kind of smooth out everything. And if you do this every day, I promise you, I wish I had pictures of my brothers and sisters. My sister, because people are like, oh no, you just look young, because that's how you guys are. No. You'll see a big difference between them and me, just because I do this technique that I'm showing you right now. Yeah. So you're going to take your, first you're starting here at the terminix, you know how you drive. I have to remember that because you know how you drive cars and you're on the freeway and then there's one car stuck, all the other cars are stuck. But before anything can move, you got to move that first one. That's the terminix. You got to move everything for it to start falling. So once you go there, you're going to go under your chin and you're going to slowly stretch down and you're going to feel swallowing. When you're like, I got it, because I feel the swallow. And then you're going to go up a little bit And now we're going to go to the pre-auricular lymph nodes, which is right by your ear, where that little flaggy thing, yeah, right there. And then you're just going to put your hand there and you're going to do the tracking because you have a post-auricular lymph nodes as well. So you're going to put this right behind the ear, and then that there, yep, right there. There's post and pre, and then you're going to just go down real slow, and you're going to feel that stretch. So what I want you to do is take your hands and go back towards your ear just a tad bit, and then down. And do that a couple of times, and you're gonna get it. Just do that a couple of times. And right now we're out here, we're talking, but when you're sitting down, when you're not doing anything, when you're resting, I want you to do that same technique. And then, so when you open up these nodes, then everything else drains towards it. So then you want to make that smoothness come, real light towards that, yeah. And then you're gonna go and pump it a little bit more. You're gonna go back and then down. It's almost like a hook. So you're gonna take it back and then down. You go toward the nose and then you drain it down. So I say you pump it and then you dump it.
Yeah, I like
pump it and then you dump it. Pumping and dumping and pumping and dumping. Go lymph flow, go lymph flow, go. Okay, and then for the eyes, okay, you have a bone right there. So you're gonna take that and you're gonna gently, like you just want to push into the bone, just not too much, just feel the bone and then move outwards. Push it to the bone and then move outward. Push it to the bone and then move outward. Push into the bone, move outward. That's gonna clear all that up, keep those lines out of your face. And then this one, you take your thumbs and that clears all the sinus. Now you put it right there, the bone up there, okay. Then you move out, stick your hand in and feel that bone. If you got big eyes like mine, pull your eyeballs down. And then you just push it on down. And I actually have to pull these eyeballs down because they're kind of bubbly. And then you're gonna go right to beat that line right there. Beautiful. And then for the forehead, to get the wrinkles out of there, you're gonna just go back like that. Just keep moving it back. And then you're gonna smooth it out. Like you're really trying to smooth out all those lines. Smooth it out. Up, 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 and smooth it out. And between your eyebrows, you're gonna make an X. Because you want to bring all that up. X, 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 X. And then you're going to go above your eyebrows again. And you're going to go right above the eyebrow. Gonna clear all that up. You can do that 3, 4 times. Each thing you can do it 3, 4, 5, 7 times. And you're gonna go up again because you want to just pull all, getting all those wrinkles out. And then you're gonna go to the temple and just do little circles there. And then you guys are gonna go and clean your face like you want anything that's missing. You just gonna go wipe it back out, go all the way down, pump again, and there you have it.
There we go.
Yes.
Beautiful.
Yes, and I promise you, if you get used to doing that, you're going to see a difference. I've been doing this for over a decade now, and I had to find pictures because I didn't like my old pictures. I seem like I like I didn't like my young pictures, but it seems like I like my pictures now that I'm older because I've actually been working with this for quite a while. And I love to hear people say, no, you're not 60. It's my favorite thing to hear.
Oh, that's so awesome. I hope you were doing that along with us. Take an opportunity and you know, we can maybe tag this in the comments if people just want to get to that part, because that's really good. And you know what it feels like is it reminded me of two things. Some of the energy healers, they do some of these kind of things and across the collarbone, but also and even some of this, but also it's just so loving. It's just like a light touch loving. It's like caressing. So, you know, as I contrast that with my like really rubbing, like scrubbing a pot, trying to like punish the leg for having cellulite before.
Too much,
like, you're beautiful.
Yes,
You just feel so
exactly.
caressing and loving of yourself. And yeah, it just is really great. And those things that you were sharing before that, deep breathing, we can do that. Drink water,
Yes.
we can do that. You know, these are get moving, we can do that. We know we
Yes.
should do that. Really challenging with our sedentary lifestyles, but it's
Yes.
important. And the people that like live to 100, the one thing
Yeah.
they do is get outside and they walk every day. And, you know, part of that is getting that lymphatic
Yeah.
system moving and keeping their immune system up, and super, super important. So
It is.
let's just share just maybe a couple of kind of like the spin-off benefits or a couple examples of your clients. We talked about you before, 36 extra pounds from the cruise, and then you were able to get that off. And so, you know, improve your energy, improve your mood, improve your marriage, improve all of
Yeah.
that good stuff.
Yeah.
What about some clients? Share some things that you've noticed with your clients as like some other benefits, just to kind of share a little bit about how powerful this is.
Okay, so there is, I have one client that I've had for maybe 8 years. He came to me one day and he was so miserable. I felt so sorry for him, such a handsome guy. He came in with his wife for her birthday, and he's like, I'm in so much pain. I can barely move. And I'm asking, what's wrong? I've had surgery 10 years ago, and I'm still on the Vicodin patch and the cortisone shot. I couldn't believe it. So it's like, wow. And he barely let me touch him. And so I says, listen, in order for us to get things to moving, we have to come up with a plan. We can't blame the doctor. Oh, he was angry at the doctors. Oh, I'm like, if you keep blaming the doctor, it's going to take away from your body healing because you have too much anger in you. So we have to focus on what we need to do. And together, if you want me to work with you as your partner, no longer blaming the doctor, it's all about getting well. We work together. 3 months later, he was no longer taking the cortisone shot. 7 months later, he was no longer taking the Vicodin. I was a little scared myself. I'm like, oh my God, he just shut down the whole thing. But I couldn't tell him, you sure you want to do that? He just did it. He says, now, what I have to do, Cookie, is I still take a little bit more medicine. We worked and worked and worked. And eventually, a couple of years later, he was able to go and do things he couldn't do 5 years later. There were things he was doing, like he couldn't play basketball with his kids. He couldn't swim with his boys. He couldn't wrestle. And they was 3 and 4 at that time. So they're like 8 now. And they love their dad. They wrestle all the time. And their favorite thing to say to him, because he's back into lifting weights. I'm so proud of him. He's back to lifting weights. He's back to doing things with his boys. But they always say, Dad, you are not buff. And you think you're buff, but he's buff. But they are the cutest because they're like, you're not that buff. So I'm so excited. I'm so happy for him because he has really, really made a big difference. And he has given me so many clients. If I travel out of town, he has family members and he will like, go see Cookie. And everybody like, you're the one who's got Mark together. And he's given me clients from everywhere. This man talks about me faithfully. I love him. He's good to me. Okay. And then I had 22-year-old Kaylin who came to me. She had menstrual issues where she had irregular periods. She had this big piece of fat around her waist and then around her stomach. And she's the only one in her family like that. Everybody else is real slim. So she feels so awkward. And I told her, you give me a couple of months to work with you, and I promise you I can change the way you look. I can change some of your body shape with the Lymphosage. I can guarantee you that. So we did. We were able to change it. She had lost 23 pounds, and then she came back and told me that her period is regular now. She's getting it every month. I was so excited for her.
You know, I think it's possible that it's a missing link for a lot of people because they, you know, they think that, you know, they're over exercising or they're doing, you know, and I don't think that they could imagine that it could be just that simple.
Yes.
it took obviously you've had years of training and lots of certifications and tons of practice with all of your clients, but really it's not. It's really just allowing the body to function as it was meant to function.
Yes.
And we don't, because we pollute it and we are sedentary and we don't move and we don't breathe and we don't do all of these things. But the power of getting unclogged and unstuck and getting things working again. And so sometimes people are like, but I'm eating healthy and I don't know why I got all this fat here. I don't understand what's going on. And so this is maybe a missing link. I think you had one other client you wanted to share a story about.
Yes, that was 33-year-old Bridget who had liposuction, and she had came to me because she didn't realize. That's also why I made that video, because a lot of these women do not know what they're getting ready to get into. They're thinking that they're going to get this fat sucked out of them. They got this slab of fat that they're looking at, and they're sewing up. They still on drugs, so they feeling good because they're like, "Ooh, that fat is out of me." But they don't realize that they just got started, because now that you have went in there and you have actually traumatized those tissues. Yes. Because the lymphatic system is so big, it's getting ready to explode on you. So she had lumps in her top of her abdomen and in the lower part of her abdomen. And then, she had the flanks done also. So her sides were really, really, really sore and tender. So we worked with that and worked with that and worked with that. But she was so upset and depressed because the tissue kept hardening on her. It kept getting hard. So we had to keep working and keep working. And she was just getting so stressed. I said, listen, go see your doctor to make sure that we're still doing everything okay. So she went to see her doctor. The doctor says, just rest for a little while. And then you go back and continue to get your lymphatic drainage massage. So she did. She rested for a little while. She came back. And one thing she was doing, she was exercising so hard. But I told her, when you get the lymphatic drainage massage, because you have all this toxin in you, sometimes you have to rest the body the rest of the evening with a light meal and kind of like, relax and think about your mindset and just think about what you want your body to do, because this lymphatic system is no joke. It's getting ready to go into war with that body. It's getting ready to say, you're not going to stay in here, but it's so much fluid at one time where it's just like I have to just keep draining. But she turned out where she looked lovely. She was getting ready for her wedding. Everything turned out beautiful. So I was just so happy that she kept with it. Yeah. And that's important. You must keep getting your drainage if you want to see recovery fast. And it's not just for, like I said, liposuction people. It's for people who have chronic back pain. It's for people who have other medical conditions. And if you talk to your doctor, a lot of times these doctors are actually telling people, go get manual lymphatic drainage. I would go look at the chart when people come and see me. I look at the form and see why, what kind of surgery did they get? Half of my people don't have surgery. Their doctor just tell them to come and get it so they can relax. I have a dentist. She has so many issues going on because she puts this mask on and she's breathing and all that stuff. But I believe she's breathing back in her own, her own stuff. So she's all congested. And her doctor said, go get a manual lymphatic drainage. She's like, I didn't even know anything about it. So I'm so excited that I had another client today. She just wanted to relax. They didn't have any surgery. So I'm thinking, this is so good that this is people starting to catch on that the lymphatic system is so powerful, and it helps when you have headaches. It helps when you can't sleep. It helps when you're bloated. A lot of people with periods, they have irregular periods. They come back, they see me, we get on a program, and it's back to normal again. You're eating again. You have swelling, so much swelling sometimes where after a while, after so many drainage treatment, they see that their ankles aren't swollen anymore. So manual lymphatic drainage is awesome.
I can see, I think for our listeners, they can see the passion and the fun, and it's that intersection of lymphatics system and fun, and the intersection at that point is Cookie Caldwell. I mean, so at the beginning, I'm like, they got to know who you are. It's so much fun, and you make this so much fun and easy, and yet super effective. So sometimes people think if it's fun, it's not effective, but you can have both. So Cookie, how can people reach you or connect with you if they have questions, if they want to know more, or if I know you've got a lot of different guides and things about, things like that. How can they connect with you?
they can go to my website. I think I got a link below, the Lymphatic Health Coach.com or cookiecaldwell.com will take you right to the Lymphatic Health Coach. And you can go to my website. There's a link where you can hop on a call if you want to make a set up an appointment with me and hop on a call. You can do that. You can download my starter kit. Now that's amazing. A lot of people find out just how congested they are just from that starter kit. They don't even realize what's going on until they take the quiz. Very easy quiz to take. Take that quiz and then hop on a call with me. And then we can dive a little deeper into what's going on with you.
Awesome. Yeah, because it is so varied, and you don't know until you chat with them. And right. I know you're a wealth of information. So if you're looking to connect with Cookie and find out more about the lymphatic system, is this maybe why you're got some stubborn things that you can't get on the other side of? It's worth taking a check. We'll just see. And so it's so remember to put the in there. THE, the lymphatic. LYMPHATIC, so that's a PH in lymphatic, the lymphatic health coach.com. And so, yeah, check it out. There should be a link below somewhere. Cookie, it was just an absolute pleasure to connect with you. Thank you for sharing your wisdom, your enthusiasm, your excitement for this. You're making a huge difference in the world. And also, I guess if other massage therapists or other therapists are wanting to know, you are in such demand, you can't possibly do it with two hands anymore. And you have a program and a course for teaching other therapists how to do this. And so they can have their own overflowing practice as well, if they would like. And it allows you to take this technique that has been honed out over the years, that is very powerful, very effective, and it's specific. It's not just like any other manual lymphatic drainage that you're going to see there. It's different. It combines fascia and massage and the lymphatic system, and there's a lot to it, and it's beyond my understanding of it, but I know the results of it, what I've seen from Cookie. And so, if that's of interest to you, reach out to her there as well, just to find out, how can you learn more about how to do what she's doing. Yeah.
Okay, let me tell you something also. The Lymphosage, that's for women who mainly don't want to go get the liposuction. I can make a difference right there, just in that stomach area and the thigh area and sometimes the butt area where we women like to carry a lot of our weight. That Lymphosage makes such a big difference. So even check into that and see how that works. If you don't want to go get that surgery done, we can work together and come up with something to make your life a little better.
Awesome. Always great to have that naturally. Either way, wherever people are finding themselves, if they've already in pain, they can't turn back the clock on that. But yes, to know that, hey, we've got other options that we can do. And there are other things, and great for them to find out about you ahead of time. It was an absolute pleasure, Cookie. Thank you for being here. And thank you for watching and for listening. Hope you got some enjoyment out of that. Hope you picked up a few tips. Definitely reach out to Cookie, the lymphatic health coach, because she's got some great information for you. So with that, have a fantastic week. And of course, be good for you.